You know that 1 or 2 day stomach bug you get with endless runs to the bathroom? Well, that's likely gastroenteritis. Gastroenteritis is acute inflammation of the lining of the stomach and intestines. It's most commonly caused by a viral infection like novovirus or rotavirus, but it can also be caused by bacteria, fungi, or parasites. The inflammation causes disruption of gut function, which causes poor absorption and increased secretion. This causes fluid and electrolyte loss through vomiting and diarrhea. Some of the things in addition to vomiting and diarrhea you might notice are abdominal cramps, nausea, sometimes you get fever, chills, and body aches. The most severe side effect of gastroenteritis is dehydration, which matters because the vomiting and diarrhea causes rapid fluid loss. There are 3 types of dehydration. There's mild, moderate, and severe dehydration. Symptoms of mild dehydration include thirst, dry mouth, decreased urine output, and sometimes mild tachycardia. With moderate dehydration, in addition to the aforementioned, you might have decreased skin turgor, which is where you pinch your skin and it doesn't return back to normal as quickly as it normally would, abnormal breathing patterns, and lethargy. Now, in severe dehydration, you might have poor perfusion, which is cool, mottled skin, and a slow cap refill. That's when you squeeze your finger and it takes a while for it to return to that pink color. You might also have sunken eyes or a sunken fontanelle for kids, altered level of conscious, marked tachycardia, and shock may develop. For example, a child who is just a bit sick can quickly become floppy, pale, and lethargic. Recognizing dehydration early can save a life. These viruses can spread very easily, so it's important to wear a mask. Now, the best thing you could do is encourage rehydration using electrolyte drinks or just making sure that the person is drinking water. Emergency services will be able to provide IV fluids and anti-nausea medications, also known as antiemetics. In mild cases, paramedics will allow you to stay home with advice, but in moderate to severe cases, transport to hospital and further management will be required. Now, a little bit more information about the emetic reflex or the vomiting reflex. It receives signals from 5 main receptors: the dopamine D2 receptor, the serotonin 5-HT3 receptor, the histamine H1 receptor, the muscarinic M1 receptor, and opioid and urocinin receptors. When triggered, they create a coordinated response to trigger nausea and then vomiting. Here are some additional conditions that could be confused with gastroenteritis. These can include a small bowel obstruction, pregnancy, peptic ulcer disease, increased intracranial pressure for cases like meningitis. There are also a wide range of other possibilities such as metabolic disorders, eating disorders, chemotherapy effects, alcohol abuse, and psychogenic causes. To summarize, gastroenteritis is common and usually viral, but the dehydration is a real danger. It's important to be able to recognize mild, moderate, and severe signs early. Out-of-hospital care focuses on hydration, symptom control, and appropriate referral/transport. In everyday life, it's important to stay hydrated, watch for warning signs in kids and older adults, and not to underestimate a simple stomach bug if symptoms are severe or persistent.